Hello, Dr. Jennifer Clemens here. Would like to talk more about viruses. I've been asked to speak more specifically about this COVID virus, so this could be viruses part 2. Reminder, this is not intended to treat or diagnose. This is meant to be educational. It is my belief as a doctor that educating patients, educating people empowers, and then we hopefully feel less afraid because fear, worry, anxiety, these things are not good for the immune system overall. I'll talk more about that in the inflammation sequence. But I think with knowing, and as I'd said before, reducing the adversarial position here can be helpful. So, a quick little reminder: viruses, bacteria, fungi, they are part of our natural environment. They've been here longer than we've been here. They'll probably be here longer than we will. Um, and they're part of our genome. And in fact, there's some viruses that we like, those fancy parrot tulips. That's a virus that causes that streaking of colors. Michael Pollan, the book Botany of Desire, very interesting read about that, worth reflecting on. And so hopefully that helps soften, and then we can take a more matter of fact approach. What do we know as of today, April 11th, had to check, 2020, about this virus, and trying to share that information as best I'm able and help make it feel tangible and accessible. So this is a coronavirus, has an envelope around it with these spike proteins that come off of it. That envelope is fragile. That's good news. So washing soap and water, drying it out are going to disable and inactivate it. And that's important to know. Those spike proteins, I'll see if I can insert a picture, pretty fascinating looking, that protects that envelope. So that's why it can stay on surfaces like plastic or metals for longer without drying out like it does on a wood or a fabric. They are specific, it's like a key in a lock mechanism looking for receptor sites. So this virus likes to land on the ACE2 receptor. And that's significant and important when you know about which tissues have ACE2 receptors. And so that could be the lungs specifically. We're hearing a lot about lungs with this virus. In the gastrointestinal tract, so some people have GI symptoms, in the kidneys, and in the brain. And so there can be neurologic symptoms. Certainly patients are talking about headache, which more likely goes with the cytokines I'll get to in a moment. But there could be many different areas affected and different presentations of this virus. And a reminder that it appears, there was a German study that just came out today, that many people are asymptomatic, don't show symptoms. So we're still gathering information about this virus. But again, we don't want to be afraid as much as possible. We want to educate, we want to ask questions, we want to reach out to our medical practitioners to get information that we trust. That's important. So what about this virus in particular? The cytokines that we hear about, it sets off an inflammatory response. That's a natural response to a virus or an infection. This virus is particularly good at really triggering a big cascade of those. And so that's that storm that we hear about. This is important a couple different ways. One, it's important to know it's a natural process. So if you get a fever, and again, this is not medical advice, so I'm not going to be specific about the numbers of a fever, but there's a moderate fever that is acceptable. Stay home, bundle up, stay well hydrated. Hydration is especially important for lung health as well, and ride it out. That fever is doing a job. You may not be hungry, that's fine. Soups, broths, these are going to be helpful things at this time, but let the body do its job. Be alert to what's too high of a fever. Be in touch with your medical professional if you're concerned. Absolutely. Staying well hydrated, being well hydrated ahead of time. That was in one of my recent newsletters. Simply being well hydrated will help the brain function better, helps the lung tissue be healthier, helps wash the waste and products out of our body that we don't want, and that's going to optimize health and wellness as well. The inflammatory process, it's tempting to think of it as just a bad thing, but inflammation can be healthy, can be good. So we want to moderate that. And so an important reminder here, specifically with COVID, many different reports suggesting ibuprofen is not recommended at this time. Yes, anti-inflammatory, but it is going to potentially prolong the inflammatory process. We really want the body to come through and do a complete concluding process of inflammation. And that means really allowing the body to do what it does well. Unfortunately, Tylenol is also has drawbacks. primarily the depletion of glutathione in the cells. Glutathione is protective. It's an important antioxidant, specifically in lung cells. And so if possible, I was just counseling a patient this morning. It's very difficult with that headache and with the myalgia, the muscle aches, but we want to avoid, if we can, ibuprofen, avoid the Tylenol, go for other remedies, primarily rest, hydration, home remedies that we can talk about, and really try to allow the body to do its natural process. Of course, staying alert to an escalation in difficulty breathing. That's an immediately either call to the doctor or go to the ED. And we want to, really be gentle with allowing that rest and that quiet. That's going to be very important. The information I'm gathering, my own medical education, went to accredited medical school. You can look on my website, more information about my schooling that I did. But today, specifically, to give you those resources, if you want more in depth, I was just trying to give a succinct information here, is you can go to Pain Free Strong Radio. It was episode 86 with Dr. Tina Moore and Dr. Heather Zwicky. Heather Zwicky is a Yale-trained PhD in immunology. She was my immunology teacher at school. Fantastic teacher. They really helped make it feel tangible, informative, very, very interesting. So that's episode 86, Pain Free Strong Radio. And then I also was referring back to the Stanford Scope, part 1 and part 2 about viruses. Very interesting. This is a lot of good information. So lead into the next. I want to remind you, inflammation, good and bad. We are an inflamed society that is putting the United States at greater risk from negative effects of this virus, and there are steps that we can take now that are very important. According to the CDC, 6 out of 10 Americans, not just adults, that includes children, have chronic disease. This is a predisposing to being an inflammatory state or potentially being on medications that increase ACE2 receptors. Okay, hypertension, diabetes, cardiovascular disease are risks that this virus is almost perfectly targeted for. That's concerning. We want to know about it. We want to be educated, and we want to take steps how we can mitigate and address that. And I would like to help with that. So stay tuned. Thank you.